Okay, so we want to welcome everyone to our seminar today, and we would want to thank you for attending. And just to let you know a couple of things, we are recording this, and we will also be sharing the presentation with everyone on our site as usual. So, as you know, this seminar series is part of the work of the Jiann-Ping College of Public Health Office of Practice and Research, and our goal particularly this semester, is to share with you the wonderful work that's being done by our community partners. And we are fortunate today to have two of them. We have Miss Kimberly Paulk from Step Up Savannah, and she is the benefits manager for that CBO. We also have, who I've not met, but welcome, and we appreciate you coming, Ms. Haley Kingery. If I pronounce your name wrong, my apologies. And she's an advocate that works with Step Up Savannah. So welcome to the Jiann-Ping College Public Health Seminar, and we look forward to hearing what you all have to present. We will have your presentation, and then hopefully some time for question and answers after that. So you have the screen, I could see. And so I'm going to turn it over to you, Ms. Paulk, and let you go from there. Thank you.
Thank you so much, Dr. Telfair. And it's an honor to be here with you all today. So like Dr. Telfair said, my name is Kimberly Paulk, and I am the Public Benefits Program Manager at Step Up Savannah. And today we're going to talk about the benefits cliff and bridging the benefits cliff and what that looks like for Step Up Savannah and for the community, and what steps you guys as a community might take to mitigate the cliff. So I'm going to move along. So first, we like to start off by talking about asset poverty. And asset poverty is still a real issue. And the asset poverty is very different from income poverty or utilizing the federal poverty limits. And asset poverty takes into consideration all the individual's assets, which includes their cash benefits, such as food stamps, any childcare subsidies, Medicaid, and is defined by the household's inability to provide for their basic needs for a period of 3 months. So here in these charts, we can see that asset poverty rate is much higher than the income poverty rate. And in households of color, it's over double. Black populations are the most affected by asset poverty. And this is showing 2018 poverty rates. And we can most likely predict that this has increased since, because it's also increased since the 2014 numbers by 35%. So this is just something to take into consideration as we talk about the benefits cliff. So next, I would like to define the benefits cliff. So the benefits cliff, which affects many experiencing asset poverty, is when an individual is ineligible for public benefits but has insufficient income to cover their essential living expenses. And we'll spend the rest of the presentation discussing the public benefits cliff and also hearing from some lived experience. So it is my pleasure to introduce and welcome one of Step Up's beloved advocates. Her name is Haley Kingery, who will tell her story about the impacts the cliff has had on her family. Hailing from rural northwestern Kansas, Haley Kingery has resided in Savannah and surrounding areas for nearly 20 years. Haley is a single mother of 3 exceptional children, 18-year-old Braden and 9-year-old Harper and 6-year-old John Clayton. She has had the honor of being the stepmother to Kristen and the late Andrew, who passed in 2016 from a rare genetic condition called Lowe syndrome. Her sons, Braden and John Clayton, have Duchenne muscular dystrophy, the same disease that took her brother Jason when he was 20 years old. At age 17, Haley began her career in the insurance industry. At age 19, she became a licensed property and casualty insurance agent. Since those humble beginnings in 2005, Haley has utilized her licensure to serve her community by providing insurance protection, exceptional service, and advocacy on behalf of her many clients. Haley now owns and operates her own insurance agency, MagIns Insurance Services, specializing in coverage for small businesses, artisan contractors, and personal insurance coverage, such as home and auto insurance. With her unstoppable passion for helping others and a fierce warrior mindset, Haley has added a new endeavor to her list, sharing her remarkable story of survival to raise awareness within the community, to inspire advocacy, to assist the silenced, abused, and neglected, regardless of their social and economic standing, who are unable to help themselves due to mental and physical health challenges. So I will now turn it over to Haley.
Thank you, Kim. Yep, one of the biggest lessons I've learned over my lifetime, and it does sometimes feel like 20 lifetimes, is that it takes the right people with the right heart to make a real difference in our communities. And considering all the things that you all have been done to be here today, I know without a doubt that as the face and the voice for my family, that I am in a Zoom room with the right people that can really make a difference and get things going with this public benefits cliff that I'm going to speak about today. And I am so very grateful and humbled to be able to sit here and share my story with you today. So thank you so much. And as Kim said, I am no stranger to the effects within the family structure when a child is given the diagnosis of an incurable, progressive, and a fatal disease. And from the very moment of my birth, Duchenne muscular dystrophy has been right here with me, and it has had an impact on my life. It's a progressive neuromuscular disorder. It occurs primarily in males, and in most cases, it is genetic mutation, and it's inherited by these young men from their mother, referred to as the carrier. Coincidentally, by fate or happenstance, my family has also been impacted by another devastating diagnosis, Lowe syndrome, also occurring in males, and again is a genetic mutation inherited by the mother. So my brother Jason, 10 years my senior, was diagnosed with DMD in 1982 or 1983. And he passed away Palm Sunday in 1997 when I was 10 years old. It was a day I'll never forget. Loved him very much, as you can imagine. In 2003, my beautiful 18-year-old son, Braden, named after a Dr. Seuss book, he was named after a Dr. Seuss reference on the last page of Oh, the Places You'll Go. And he is a 2022 high school graduate from Johnson High School. And I'm so proud of him. But he was diagnosed with the same disease in 2007. And roll around to 2018, and my youngest son, the wild and crazy John Clayton, was diagnosed as well. Our family was also blessed with Andrew Kingery, my beloved stepson, who we lost in January of 2016 after his courageous and inspiring story of strength, journeying through life with Lowe syndrome. As the one of two mother leaders in our blended family, I share that title with Becky, my co-parent's first wife, and I don't think she will mind that I speak on her behalf, along with all the other mothers sharing this boat with us. As a mother, we are blessed by God to be the primary caregiver. I'm so sorry, you guys. Primary caregiver to our babies, and there is no greater joy in that. When we begin to realize that something isn't quite right with our babies, it's our hearts become heavy. When the doctor gave us the news that I'm sorry. Starting over. As a mother, we are blessed by God to be the primary caregiver to our babies, and there is no greater joy in that. When we begin to realize that something isn't quite right with our children, our heart becomes heavy. When the doctor gave us that news, our hearts sank. When we are told that our DNA, our mutation, is what caused that something not quite right, there are no words to describe what that hurt and heart feels like when it shatters. It is like the hurricane. You see it coming, you make preparations, you brace for the destruction you know is coming. You hunker down and you love hard and you find your strength, and you know you'll find yourself on the other side of that storm. You just be patient. You just pray. You just have hope. For you know that on the other side, after the clouds have cleared, you will start to pick up the pieces. You know there will be recovery. You know there will be community to help you along. You will rebuild and your family will be whole again. Your babies will be okay. It takes a village. And then you get to our current state. However, being patient, praying, and hanging on to hope during the storm, setting on this benefits cliff, well, friends, that's the struggle. That's the hardest part. That's where advocacy and compassion, community and love are needed. And that is exactly why we are all here today. My job duties currently include the following. I'm a concierge. I'm a home health care nurse. I'm a cleaning lady, lawn care landscaper, occupational and physical therapist, mental health professional, chef, laundress, and I'm a private chauffeur. That fits very little time and energy into being the small business owner that I have dreamed to become most of my life. There's not much choice in a regular 9 to 5 when you've got all the job duties that go into caring for 2 children with severe special needs, while raising a third that by the time she's my age, she will have lost all 3 of her brothers and could possibly be a carrier of the same devastating disease herself. As you can imagine, I sit before you today with a broken heart and a broken mind that I must work to mend every moment of every day so that I can continue to be the amazing mother that I am, to keep the passion alive, to keep on fighting. But the fight gets harder every day, and the fear grows bigger with each swipe of the debit card, with each bill that comes in the mail, cutting away funds for the important self-care that I myself need to keep going. Today, I'm standing on the cliff, oftentimes paralyzed by fear as I watch the assets I have accumulated over the last 15 years to provide a life for my children and me slowly dwindle away, asking myself at what point will I finally break completely? On this cliff, yes, we are surviving for the time being, but it is getting to be merely surviving. We want to do more than survive. We want to live. As a mother, I'm raising future leaders. Our future leaders need current leaders to look up to. And this mother right here, this leader, I am the voice of so very many within the community praying loudly for help through the storm. Thank you for giving me a platform, a stage to speak upon today on behalf of all of us Cliffers. And I am so sorry my teleprompting did not work to begin with, and I had to read all of this off my phone. But thank you for listening. And it's a cause very, very close to my heart. So thank you, Kim.
Awesome. Thank you so much, Haley, for your bravery and sharing that story. And Haley is one of many who experienced this. And so this is what we call the public benefits cliff. And I want to define it a little bit more, dig a little bit deeper into what the cliff is. And so who experienced the cliff? It's both those who are already receiving public benefits and those who are ineligible for public benefits, and they're already kind of in this, what we call the cliff. So those who are already have public benefits experience it when they get a slight economic promotion, and because of that economic promotion, it causes them to lose public benefits such as SNAP, Medicaid, CAPS, WIC, TANF, housing, Social Security, all the federally funded benefits. And so, so with that, we know that this is a benefits cliff. And so, and we'll go into like the consequences of that as well. Then there's those folks who are already ineligible for public benefits, and they're already receiving that middle wage. They're considered the working poor, they're experiencing asset poverty, and they're already not eligible for those benefits, and they never have been eligible for those benefits. And so why does this occur? And so kind of how, one of the things is policy pitfalls. And Haley alluded to some of the assets that she has, the asset limits. And so that's one of the policy pitfalls, because even though families are, they might have these assets because they sold a house, or they may have had some inheritance from somebody who died or whatever, but they have very difficult situations where they're not able, to work or but they still need those essential living items, such as childcare, such as care for their children who have disabilities. They still need food. They still need Medicaid. And it creates these really difficult situations because of these asset limits. Another one that I like to talk about quite a bit is the work requirement that is put on students. So if you're a full-time student, then you have to work at least 20 hours a week to be able to get SNAP benefits. And this is something that we advocate for a lot, because in our opinion, and really, like, as a best practice, and what a lot of advocates across the nation talk about, is that students should be able to meet that work requirement without having to meet an additional work requirement. And I used to work at the Savannah Technical College a few years ago, before I came to Step Up, as their benefits enroller. And I would see it all the time. I would see folks who were working full-time not working, they were full-time students. They were in full-time unpaid internships, and they were in tutoring 5 to 10 hours a week, and they didn't have time to work 20 hours a week. They some of them would work like 10 to 15, but then they still wouldn't be eligible for the benefit. Now, there is some other waivers in place. So if you have small children, or if you are in the work study program, then you can kind of get around that work requirement. But that is the reasons, as far as the policy pitfalls that some might experience. We also know that the state of Georgia has not expanded Medicaid, and there's strenuous requirements. It's a very, very low income limit, and they cannot the single adult does not have access to Medicaid. And they're looking to expand it a little bit through their Pathways initiative that may be going through and becoming eligible in Georgia, but they're putting work requirements on that too. And when I did a quick calculation, a lot of people will be ineligible for that benefit. So it's just really hard. And there's also lack of access to direct services. We did a survey back in 2021 with all the social safety net providers, and we learned that a lot of the social safety net providers also go by these federal poverty limits. And so that creates kind of the same issue. Like, there's no transitional resources for folks to go from public benefits to self-sufficiency. And it just creates a really big problem in our community. And Step Up sees this, and there's some things that we're doing, and we'll talk about that a little bit later in the presentation. But right now we're really working to educate our community on what the benefits cliff is and how it impacts. So the consequences of this is folks avoid economic promotion. We hear it all the time. We hear, I don't want that job because it's going to cause me to lose my Section 8 voucher. I don't want that raise because I'm going to lose my SNAP benefits, and I really need those SNAP benefits, and it's not worth it. And a lot of times, and I'm going to show you on the next slide, the increase of pay does not satisfy the increase that you need to cover that expenses that public benefits is covering. So it's not worth it to individuals because they're actually making more money and they have more assets on the public benefits than if they were to receive that little raise. And so it makes sense. It's very smart that people would stay on these benefits and not get that promotion, because it's very, very scary, and it's going to cause them to go further under and experience poverty at a much deeper level. And so that creates this generational cycle of poverty. It's just on and on and on, because the parents can't afford certain things. So then it passes to the children, and it goes on and on and on. And then it's also a consequence for the federal government who's providing these funds for these public benefits, because more and more people are on these benefits and the benefits start going up in the amount of cost. And so it's just, there's no difference in the poverty rates when we're not providing these transitional services to get people out of that cycle. So here I did some analysis on a few benefits cliffs in Chatham County. I used our average children rate of 2.5 children and showed analysis for 1 adult and 2 adults. This red bracket here emphasizes the income comparison between asset poverty and 100% of the federal poverty rate, or federal poverty limit, that's emphasized in that green color. Further, the average monthly income in Chatham County is $4,199 for 1 working adult. 2 working adults would be an average of $8,398. This is still lower than the cost of living in Chatham County. And that difference is emphasized by that red dot that you see on the screen. So that's the gap. This chart does not show the additional requirements such as priority groups, approved activities we were talking about, citizenship status, and these all create additional barriers for individuals. Further, these are examples. We could show others with housing, utility assistance, cash assistance, or TANF, and WIC. However, the bottom line is the federal poverty limit is much lower than Chatham County's cost of living. Also, with inflation, it is likely that future analysis will show increase in livable wage with little increase in the federal poverty limit. And so this is just a little comparison for your SNAP, which is indicated in orange, your Medicaid, which is indicated in yellow. The light blue is the parent caretaker Medicaid, which is a huge gap. You can see how low your income has to be as a single adult and 2 adults. So, and that just emphasizes the need for Medicaid expansion. And then also TAPS is this green, which is much higher. So with that, and the issue that we saw in our community and still see in our community, in May, between April and May of 2021, Step Up Savannah ran a survey called the Bridges Beyond Benefits Community Survey. We were able to survey 434 unduplicated households, and we targeted specific to low to middle income communities. And on the screen, you can see all the partners that were a part of this, including the task force that we now have at Step Up as well. So I'm going to go over kind of some of the analysis and the findings of that. And so first we want to know, who took the survey? And so the majority of the folks who took the survey was African American. And then the second highest was Caucasian, followed by Hispanic. And also the majority of folks who took it were female. But we also got 31% male. But we also know that the individuals that experience poverty the most are African-American females ages 18 to 34. And that's emphasized in who we got the surveys from. And also, this kind of goes to show too, is that the most were single head of households. So again, it's that African-American female, single, 18 to 34. And then that was followed by the 2-parent households. We also looked at employment status, and there was a divide between those working full-time and not working at all. Less than 50% of our participants were working full-time. This was followed by not working at 23% and part-time at 13.7%. As you can see, there's about a 40% of participants who said they were not working, and we can gather that roughly 60% of the participants did not have a stable job paying livable wages. We also concluded that 62% of the households included 1 to 2 people who were working, The other 12% were households with more than 2 working members. We also asked who was unemployed. 85 responded with yes, and 247 responded with no. We can think of this as in terms of unemployment rate. Unemployment rate is those who are both employed and looking for work. And we can say that of the valid responses, a quarter of this population is looking for work. So that was a very important finding that we found. We also looked at income limit and gross income of the households. And about 70% of the folks who took the survey's income was under 45%. So that again shows that we had an accurate population because they were that low to middle income group. The other 30% accounts for 45,000 or more in the rather not safe group. But we also know that the household size was differentiated as well. So this, like I said, the data confirms that we targeted the low to middle income community. All right, so that was who took the survey. So now we're going to talk about some of the key takeaways. The survey looked at needs that are related to public benefit assistance. Both folks who received and do not receive benefits answered this question. Nearly 1/3 of those surveys needed help affording basic needs. Another 1/3 needed utility assistance. Another that was brought up was a need for help applying for services and a need for housing assistance. Other needs included access to or cost of food, your mental health care, adequate transportation, time, and contacting support related to benefit assistance. We looked at non-governmental agencies as well. Out of all the non-governmental agencies, food and healthcare resources were accessed the most. Low-cost healthcare includes a combination of dental, vision, general, and mental health care. Healthcare was followed by food access. And so also something important to look at here is that when you contact faith-based organizations, and most of those are looking at are wanting food when you're contacting your faith-based organizations, or they're wanting help with their shelter, utility assistance. So we could actually add that 16% most likely to these other numbers. Here's where we took a deeper dive into food insecurity. Folks who were denied SNAP accessed food banks about 14.5% more. Single parents received WIC and SNAP more than other households. There are transportation barriers to WIC, which is also a food access issue. There are also technology barriers. Those who did not have access to a device were denied more. Those receiving SNAP received less income, which makes sense, but those who reported needing help with food costs were denied benefits 31% more than those who did not need the help or on benefits. So this shows that people were applying for benefits and they were experiencing food insecurity because they were denied for those benefits. And those who were on SNAP needed the benefit was helping them in their household, and they did not exhibit as much food insecurity. So here I also last year did an analysis on the SNAP denial reasons, and there were 7,713 people who applied and were denied SNAP, which is almost 15% of the total applicants, which is it's a very big number. This number is double the pre-pandemic number of 3,255 people. So we see that the pandemic did exacerbate the food insecurity. Half of those were due to exceeding income limit, and the other half was due to other variables, such as failure to keep an appointment, insufficient verification, or other eligibility requirements, such as does it meet the student requirements or the asset limits, etc. We also screened for housing related issues. Nearly half of the participants said that paying the cost of monthly rent and utilities was their number one issue. This was followed by finding safe and quality housing and making a down payment on a home. About a quarter of the participants said that finding housing near public transportation was an issue, which we also know that Chatham County does not have countywide transit. So this is, and this is hard. It's less in low-income neighborhoods, the transportation is difficult to find. So here's the child care snapshot, and we looked at the barriers there. And those needing daycare on average earned about $20,000 less than someone who did not emphasize that they needed daycare. Single parents are experiencing child care insecurity more than other households, and COVID magnified this issue. Transportation barriers add an additional layer because those who needed childcare also needed transportation 56% more of the time. And those with households of about 4 needed childcare more than 2-person households. And this one was hard to grapple. Those who were raising their children and children of others made $25,000 less than those who were not caring for their children and children of others, which is likely due to the childcare inaffordability. And so that's, you know, when we talk about family, friends, and neighbor care, they were making less. The survey also showed that CAPS is a helpful benefit because CAPS recipients needed daycare 75% less than those who did not have CAPS. Physical limitations also added a layer because folks with physical limitations expressed the need for childcare 50% more. Here we looked at transportation issues, and an average of 21% of participants said they had transportation issues, while an average of 43% said they did not. The other 36% selected the issue was not applicable to them. Here's a breakdown of those that said they had a transportation issue and the percentage of each. Most of those who had issues with transportation either said they needed reliable transportation or cannot afford transportation. "75% of participants said they had access to health care, and this included governmental and non-governmental health care. This percentage includes 50% dental, 70% health, and 43% eye care. The other 25% said they did not have access to health care at all. Of these people, most said the reason was that insurance is not affordable. A small percentage said they don't know how to get access. So that was our data from the Bridges Beyond Benefits Network. And so we come to the question, okay, what now? What do we do? And so Step Up Savannah has started some initiatives to help with this benefit cliff. As mentioned before, we are convening a bi-monthly Bridge the Cliff Task Force meeting, and this is made up of stakeholders and agencies and community members and advocates passionate about bridging the cliff together. We launched in July a Step Up Savannah Bridges Beyond Benefits Network, and you can find that network on Facebook. I can also drop it in the chat when I get done with this presentation. And the goal is to bridge the public benefits cliff by encouraging community and peer engagement through information and resource sharing. So through this group, members can share in resources and answer questions in the group. And if you haven't already, I encourage you to join this group. We share information, we share best practices. If there's resources, there's transitional resources that might help folks, we share that information as well. And you can share information. If you have a resource or you know of anything, you can share those resources as well. And I'll go ahead and drop well, I think I have to exit out. So I'll drop the link in the chat before we get off here. And we are also collaborating with national, state, and local coalitions. Some of these include 9 to 5 Georgia, Georgia Budget Policy Institute, Prosperity Now. We have partnered with the New Hampshire Department of Human Services. We've partnered with Erie County, New York Department of Health and Human Services. and the Federal Reserve Bank of Atlanta, and we're looking to have a nationwide learning cohort, where we can learn from each other's experiences and best practices. We also know that education is key, and that's part of what we're doing here. We did listening sessions with several nonprofits, and we quickly realized that folks either were not thinking about or did not know what the public benefits cliff was. So a key goal is to create awareness by educating stakeholders, employers, and the community at large about the benefits cliff. Through education, we hope to build a community who thinks through how the benefit cliff affects their everyday life, their colleagues, their employees, their employers, and how they might take a step to create some change in our community. We are also having conversations, like I said earlier, with others that are tackling the benefits cliff, such as, like I was saying, in New Hampshire, New York. We have some partners in Tennessee, and we continue to research best practices and evaluate what programs we might create in our community. Also, in 2021, we, like I said, partnered with the Federal Reserve Bank of Atlanta, and we created what we call the Career Opportunity Dashboard for Economic Mobility. And this tool is designed to compare career pathways to the gains and losses of public benefit. So it has a career planning component as well as a budget component, where folks can put in their budget and how much they're paying each month for certain expenses. And it'll show you like what the self-sufficiency target is, how someone might look at getting off the benefits cliff, or where the cliffs will occur, and so that they can plan for those challenges. And so this is a very helpful tool, and Step Up provides this one-on-one guidance with folks. We can either do it through a form, and we can give them send them a printout of the report, or we can also have a one-on-one session where we can plug in their information and talk it over with them, which is really what we prefer. So what are we doing now? First, every social safety net agency should be spurred to evaluate program requirements. Are there necessary requirements that can be changed to be all-inclusive for the entire low to middle income community? Are there services that can help raise their net worth and alleviate pressures that they are facing? We have also tackled our B3 survey. However, we are continuing to analyze data from this survey and looking at other information that our community may provide to look at these benefits cliff as well. We want to build up and utilize the code tool that we just talked about, and we'll be likely training other community agencies to also provide this tool to their constituents. It is also important for our social safety net, employers, municipalities, stakeholders, policymakers to be aware of the benefits cliffs and create programming and resources aimed at mitigating the benefits cliff. So is there anything, like if you're an employer, is there a way that you might be able to provide a childcare stipend or a gas card, or just something that would benefit the employees, especially those low income employees that are not meeting that livable wage for Chatham County or whatever county you may live in. We also need to think about innovative ways to expand the connection between the social safety net and the low to middle income community. How can we better communicate to them in a way that they can understand and that they will receive this information? Are the current outreach efforts effective, and how do we know that they are effective? Are we evaluating our outreach impact regularly? And also thinking through those transitional resources, like, do we have to have federal poverty limits on our resources? It is important to use asset mapping as well, where we determine what is already working and build upon them. How can we work together to strengthen the impact of the LMI community? Are we duplicating services? If so, how can we not do that and just make the programs better that are already existing? Are there services that we might combine so we can lighten the load and be more helpful to our constituents? We're also looking for funding opportunities that will build upon services that are already available and also help us to make services better and provide those transitional resources. So we're asking the questions, are there opportunities within funding to build meaningful partnerships and combine the assets of our local social safety net? So this comes to the last point, which is how can you get involved? So one way that you can do that is join hands with our community assets. We are we use the asset-based community development model to build on the assets of the social safety net, our employers, our stakeholders. And we are very adamant about decreasing silos, working so that we can work together and not as individuals, because it takes a community to fight these issues. You can educate fellow colleagues, friends, employers, and stakeholders about the benefits cliff. You can join the Bridge the Cliff task force that meets bi-monthly. We meet on the first Wednesday every other month at noon. And we work on different tasks each time. So like right now we're working on some of the childcare issues in our communities. You can also promote the B3 network, which is the Bridges Beyond Benefits network. And I'm going to drop that link in the chat, like I said. Here is my contact information. You can email, text, or call, and I can also drop this information in the chat as well. And we also do not want to end without thanking our sponsors. And I am now open to questions, Dr. Telfair.
Okay, so before we get to questions, I just want to sincerely thank both of you for this presentation, especially Ms. Kingery, just for sharing your heart with us. We appreciate that just all so much. I hope you understand that. So we are open to questions from the audience. A number of people joined us in process, so please unmute yourself. So we do have a question. So from Christina. If you could just go ahead and unmute yourself and ask the question, that would be great. Hello.
Hey. Hi, everyone. I was just wondering what the task force actually does when you meet bi-monthly. You said you're working on health, child something. I'm sorry.
Yeah, I can definitely go into more detail with that. So the task force, for example, was responsible for we worked together to create the survey. When we initiated the survey, we went through the questions, making sure that we were asking the right questions. We worked together on that. We have with the Facebook group, the Bridges Beyond Benefits Network, we worked on that 1 week, just trying to figure out okay, what kind of content do we want to share? What kind of assets do we want to build upon? What partners do we want to invite? Doing some asset mapping. We did a asset map where we listed out all the different partners that we wanted to be a part of the group, how we might reach out to them, the key contacts. With the childcare issue, we've partnered very heavily with 9 to 5 Georgia, who is doing a childcare analysis. They've done some data analysis. We've had some opportunity for them to share with the group, and we're coming up with ideas how we might fix the childcare issues in our community, like a childcare fund and having partnering agencies. And then next meeting, we're going to work on writing a letter with some key components of the findings that we have found and how some of the solutions that we've looked into. And 9 to 5 is very heavily involved in that process. So it's basically tasks that help mitigate the benefits cliff in our community, and it differentiates from meeting to meeting. But the whole, what I'm saying is the whole task force is very heavily involved in the decision making, and we build on each other's assets and knowledge and brain trust to build out benefits cliff mitigation. Does that answer your question?
Yeah, that answered it. Thank you. Would you need to like know anything about like what y'all got going on? Because I just kind of dropped in and I was like,
Yeah, yeah, we get that a lot too. I mean, we definitely need, so there's different ways you can join the group. So one, we definitely love to have people who are passionate about the issue and that can serve as an advocate, and you can learn it. And I have like a whole history, written up and stuff. So it wouldn't be hard to kind of learn where we're at, where we're going, et cetera. And then we also have folks who can come in with learned experience that can say, hey, like that's not going to work, or hey, that will work. And then also the social safety net who has experience on the other side helping individuals. And then, other stakeholders such as like city officials, et cetera, that we would also love to join the group as well. So no matter where you're at on that continuum, there's a space for you.
thank you so much for answering my questions.
Yeah, thank you for asking.
Thank you. So additional comments or questions? Just unmute yourself, please. Okay, well, I actually have a question that it comes from a lot of the work that I think we do in public health. So this is for Ms. Kingery. So one of the things that we always are looking for, because as you know, we are less of an individual focus group than a population focus group. However, one of the things that we get asked a lot to do, it has to do more with policy, which is forming, you're very familiar with that. And I was just wondering, based on your lived experience, what are some of the key policies that we in public health, particularly us who do community-based participatory work, really can focus on to really assist persons like yourself and others that you think are important, particularly here in our neck, here in Georgia, and particularly in the southern part of the state.
Sure. The main thing is, I know that there are so many people that need help. And when I have personally gone to different organizations just to ask for help, I just would like things to be handled more on a case-by-case basis and more with a little bit of compassion, because you could probably tell from just speaking on these things, it's very emotional. It's very hard. Now, in my particular case, I'm dealing with children that have disabilities, and I know this benefits cliff affects so many other areas, like Kim was speaking on, students or, just young adults, that sort of thing. And in my experience, it felt like to me that when trouble arose, I was a 17-year-old with a baby. I didn't want my dream to just die, and my dream shouldn't have just died, but I was put into a position where I was working an administrative job and making too much money for public assistance. But, what choice did I have? You know what I mean? So it's just, and when I went to go get help, I was young, I was naive, I didn't know what I was doing, and it was disheartening to the point where I gave up, and I just had to pick it up and handle everything myself, and it did get me into, I learned a lot, and I taught myself learned how to survive, where maybe having a little bit more help could have made it, a little easier journey for me and my baby, so, but we made it. I hope that answers the question a little bit.
Yeah, so I worked in this area with children and families, special health care needs for about 40 years now, right? I started as a social worker, and now I do what I do. And what you shared, to me, it's enlightening, but it's unfortunate, because I thought we were much further along, at this point, given we've spent so much time, so many resources into that. So I think my questions is, I appreciate that your personal experience is what it is, and when I wish it wasn't, but it's as us who have to have an influence on policies and laws. I just was wondering, what suggested improvements, do you think we, particularly us in our school, because we do a lot of work and research and we work with a lot of different people, can do so that the pathway that, folks like yourself have in terms of getting the resources you need and support you and that sort of thing. And a lot of the things that Ms. Paulk mentioned are important and can be really addressed. I know, because I'm a poverty advocate, so I know that it's been like, we'll never get rid of poverty, and that's a fortunate reality. However, I know we could do more, and I know we can do better. So I guess that's what I'm just asking. I'm sorry, Ms. Paulk.
Yeah, I was just gonna say, and maybe this can help you a little bit, and you can confirm or do not, that this would be helpful, Haley. But I think like having more transitional resources for folks that aren't eligible for benefits, whether it be at the state, federal level, or as a community as a whole. And I mean, that's kind of where we're at, is that education piece of like, okay, like this is really affecting people. Like, why are you putting these same limits on things when there's people who are facing poverty that need these resources, And so like, it's either like you're in poverty, like you're below the federal poverty limit, or you're not, and you don't have those resources. So I think a lot of it has to do with, like increasing somehow the transitional resources, increasing the poverty limits to match the community's cost of living, like take into consideration the actual communities to adjust your federal poverty limit, and having more knowledge about what poverty really looks like. And whether it be money needed, I really don't know exactly what like the solution is, but I know that this is a step. Like the need is the transitional resources and to really have an actual federal poverty limit,
Right. And I think another thing, and I may be speaking wrong, but some of these especially for folks like me, I mean, I've had dreams, I've warriored on, I've survived, I've done the things to build a career, and it's some of these programs more a goal oriented, like 6 months here, let's meet this to continue your benefits. A year from now, I want to see you here to continue your benefit, that sort of thing, if that doesn't exist, if that makes sense. I guess I don't know how to explain it quite right.
It's okay.
But and then also other parts of the like more, I don't know, mental health help or like life coaching kind of thing, something that can be intertwined into these benefit things to give these young people, I'm speaking from a young mother's perspective, a young lady's perspective that had a child young and needed these benefits to not only make something of mom's life, to be able to provide an excellent life and a role model figure for my son, which I did. I just wished that there had been some resources available to me to help me along the way, not only financial, but life skills as well, because I think that they could very much work together to keep people off the public benefit spectrum, grow out of it like it's intended to be done. If that makes sense and helps at all.
It does, and I think Ms. Oli Yede makes a point. One of the things that we try to work with our students and our faculty members is finding a place where in the public health sphere of things, we can place what you both are talking about. And one of the areas, and I think if Ms. Oyende could take a few minutes and talk about what she suggested, I think that'd be something that would fit. Could you go ahead and do that, Ms. Tovey?
All right. Thank you, sir. Yeah, so when Ms. Haley talked about creating mental health, providing mental health solutions, and also I just thought about our story, and if we really want to help people in that area, or people who have similar experiences, I was thinking that having trainers or even people who are trained to give trauma-informed care, to be much more empathetic, it would have an effect.
Okay,
And
thank you.
providing that hope, that hope to that next step. Like that's kind of the philosophy that is the philosophy that I go by. Like if somebody calls me as a social safety net provider, I may not have any resources, but my job is to provide them hope to get to that next step, and having that understanding of like these people, like there's people that are in the tyranny of the moment, they're very stressed, they don't know how, like what the next step is, and like stopping with them and saying, okay, like we're going to get through this together. And sometimes like you're the only person that has said that, or stopped to work through that. And I think like having that as part of our just natural instinct as social safety net CBOs, so that people feel like they have hope and opportunity to grow,
Okay. Yeah, Miss Christina.
Sorry, another question is like, I'm like a undergraduate, obviously, not obviously, but so I don't really like know really, but is it just the fact that there wasn't any data on, what people are experiencing, or was it like they didn't know, like the government or whatever, or was there just like there was no importance in it, or like where was the disconnect that got us to this like point, I guess?
The disconnect that got to this point. I mean, I think that it's just systems that have been in place, for what seems, forever. Like it's systems and like really understanding what poverty looks like, and folks who are making the policies not really understanding that or having different opinions. It can be very political and based on money and finance. So it's very, there's a lot of nuances. It's very multifaceted. But yeah. Does that answer your question?
Yeah, sort of. Thank you.
Okay.
Okay. Well, we're at our time, and I hate to cut off the conversation, but I know we have to sort of go. So again, I am truly grateful for both of y'all to come and speak with us, and hopefully we'll get a chance to do that again. And I do wish the best for both of y'all, both in you, with you, Ms. Kingery, you and your family and your work, and Ms. Paulk, your work. It's really enlightening for all of us. And while we focus a lot on policy and population level health, these type of conversations are just really enlightening, because it adds a lot to not only to what we see we can do, but also what we need to do. So thank you so much for your time, and thanks everyone for being on the call. Please look, if you have questions, please follow up with us, and we will be posting everything. And then for our next seminar, which will be coming up soon, we'll let you know. So anyway, thank you, everyone. And
Thank you
we hope
so
you have a
much.
good rest of the day. We appreciate you taking the time.
Me
Okay.
too. Thank you.
Thank you. Okay.
Bye. Thank you.
Bye.